probiotics can have an appreciable impact on depression.
Wow.
Who would have thought, right, that probiotics could help something in the mind? But this is truly, as you're intonating, the connection between the gut and the brain is just one of the many connections the gut stems to.
Hello and welcome back to another episode of the Thrive State Podcast. I'm your host, Dr. V, triple board certified MD and performance and longevity expert. And on today's episode, we're going to talk about everything gut health. I have the gut health expert, Dr. Michael Ruscio. Here on the podcast today, we'll be talking about testing. We'll be talking about prebiotics, probiotics, what is the best diet to be on, and more. So you're not going to want to miss this. But before I introduce him, if this podcast is giving you any value, please consider subscribing to the podcast, sharing it with your family and friends, and then giving us a 5-star review at ratethispodcast.com/ThriveState. Doing so will really help the show grow, and I would appreciate it if you did so. Also, if you haven't picked up a copy of my book yet, you can do so at ThriveStateBook.com. Now, when we consider medicine these days, there are many practitioners that say start with the gut. And there's a reason for that, because really the gut is that interface between the stuff that we are pulling in from the environment to our internal bodies. So, in the practice of medicine today, many practitioners say start with the gut. And there's a reason why they say so. One, because the gut is really just that interface between everything that is consumed from the environment to your internal body. It's a gateway of what can actually go inside your body. And right next to the lining of the gut is also a lot of immune cells. So if your gut is not healthy, it actually could cause a lot of problems, including a lot of autoimmune disorders, as well as chronic inflammation. So that's why many practitioners say start with the gut. But where do you start? This is why I have my guest on today. He's Dr. Michael Ruscio. He's a doctor, clinical researcher, and author that's fervently working to reform and improve the fields of functional and integrative medicine. With his clinical and research teams, he actually scours existing studies to inform his ongoing clinical research, patient care, and guidance for health seekers and fellow clinicians around the world. His primary focus is digestive health and its impact on the other aspects of health, including energy, sleep, mood, thyroid function, and optimization. Dr. Ruscio's research has been published in peer-reviewed medical journals, and he speaks at integrative medical conferences across the globe. In fact, I just remember introducing him when I was a moderator at the A4M conference. While actively seeing patients in his clinic, he also runs an influential blog and podcast, as well as a newsletter for functional medicine practitioners. Ladies and gentlemen, please welcome to the Thrive State Podcast, Dr. Michael Ruscio. Many functional medicine doctors say they start in the gut. Is that the best place to start? And should everybody have a complete gut workup? What's your approach to that?
Well, I do think it's important to start in the gut, but we broaden it out a little bit in our clinic, and we call it the diet, lifestyle, and gut health foundations model, right? Because if you're not sleeping and eating terribly, interventions like probiotics, it's really putting the cart a little bit before the horse. So I think this should be layer one of the healthcare picture: diet, lifestyle, and gut health. And to your point, I'm so glad you posed this about a workup. It took me many, many years, because the lab testing was so helpful for me, to realize very few people actually have true parasites. And the people who do have imbalances, let's say dysbiosis, which is kind of an ethereal diagnosis that we don't really have, good normative data for yet, or something that does have good data like SIBO in terms of there's a definitive diagnostic criteria, the testing doesn't really do a lot to change how you treat the person. And this really matters because, me 15 years ago, not sleeping, brain fog, I would do anything to feel better. Sure, I'll pay tons of money for the lab testing. But if the clinician doesn't bridle the patient and say, hang on, I know you want to feel better, it doesn't mean throwing a bunch of money at testing is going to expedite that. Let's just hold off and use good common sense clinical decision making, and that will usually get you the results in GI or many other areas, not all areas, right? There are some areas where you do need a diagnostic workup. You may not be able to tell if someone's frankly diabetic just from looking at them, right?
Yeah.
Or empirically trying metformin, let's say. You need that biomarker. But the biomarkers in GI, for the most part, especially in kind of functional and integrative GI, they're theoretical.
I don't think some people are aware of like issues not related to the gut. Like it's not diarrhea, it's not constipation, it's not bloating. It could be something in your skin or your brain, and it's still connected to the gut. Can you talk a little bit about that and maybe some of the non-GI related symptoms that people could have that emanates from the gut?
Absolutely. It's such an important issue to put on the table because for someone like myself, they can be chasing the symptoms that are not digestive symptoms, thinking that the symptom is emanating from the end tissue being affected, like the brain or the skin. There was times when I said I needed an MRI, because I was thinking, what's wrong with me? But yeah, now we know that things like food triggers or imbalances in the bacteria colonies in the gut, or just more simply leaky gut, can lead to skin problems like atopic dermatitis, rosacea, urticaria, or hives. Can lead to things like MCI or mild cognitive impairment, brain fog, anxiety, depression, joint pain, problems with the thyroid gland. Just to name a few, there's other data looking at correlations between metabolic health and small intestinal bacterial overgrowth, correlations to lipids. Some of these correlations are stronger in terms of, do they move the needle enough to really affect you? Or is it more of an interesting research finding that's within statistical significance, but not enough to be clinically meaningful?
This episode of the Thrive State podcast is brought to you by the Thrive State Accelerator. The Thrive State Accelerator is actually a home course that I developed using the exact same techniques I work with my celebrity clients, CEOs, and executives on how to get them to the Thrive State. The Thrive State Accelerator teaches you how to master your 7 bioenergetic elements. That's sleep, nutrition, movement, stress and emotional mastery, relationships, our thoughts and mindset, as well as purpose. In this Thrive State Accelerator, you're also going to get a bonus module on optimization. That's how I talk about supplementation, peptides, all the optimization techniques I use with my clients to get them to the Thrive State. Now, for some of you who are just joining us for the first time, you guys might be wondering, what is the Thrive State? Well, the Thrive State is actually the energy, the epigenetic environment we give to ourselves, telling our DNA how to act and how to respond. And if we want optimal health, longevity, and peak performance, if we can master these 7 bioenergetic elements, our ability to have those 3 things that we just said, optimal health, longevity, and peak performance, is at its greatest. And it also prevents you from getting chronic symptoms like brain fog, being overweight, feeling sluggish, acne, pain, all these chronic symptoms, as well as preventing you from getting chronic disease. So getting to that Thrive State is really getting to that state to master being that very best version of yourself, so you could show up for you, for your family, for your business, everything that's important to you. So go ahead, check it out right now at kienvu.com/accelerator and use coupon code podcast25 for 25% off. Now back to the podcast.
Let's talk a little bit about gut health and diet. Would you say that before coming to any practitioner, should people start to do things on their own first? And I think I've heard you over several podcasts talk about 2 diets you like, a paleo-light diet as well as a low FODMAP diet.
Yep.
Can you talk about why you would go after those diets first?
Yeah, great question. And the paleo diet, not that I'm married to that, and that's why I often say paleo-like, just to kind of impress upon people. It's kind of a hazy boundary. It's a rough proximity of, okay, let's reduce processed food. Let's focus on, in the spirit of a Paleolithic ancestor, things that you could hunt, fish, or forage. And just eating stuff that doesn't come out of a package and has not been, or only minimally so, been processed, that takes care of a lot of the problems with modern food and diet. We're working on a paper regarding probiotics to perform this, essentially a narrative review that outlines this for people. Zooming way out, probiotics work, prebiotics work. The exact formula that you use doesn't seem to matter a whole lot. The probiotics have better evidence for most things than do the prebiotics. Prebiotics can flare some people. This is why some people may notice if they have too many bars, they get farty, right? Because a lot of the bars have high doses of things like inulin in them, which again, can help some people. It just depends on what's your gut constitution. Like some people thrive, let's say, on a low carb diet. Other people do poorly on a low carb diet. Similar with prebiotics. Some people have kind of a limited threshold that they can tolerate. Other people do well on a higher intake. So to put these things in a kind of order of operations, I would start with the probiotics first. More evidence, better evidence, less adverse events. And if using a supplemental probiotic is helpful, great, stay there. You don't necessarily have to add in a prebiotic. You could do that secondary or after the probiotics. Now with probiotics, there are a lot of formulas. And what I think is happening is industry is starting to influence the education and the marketing.
Naturopathic medical training, you got chiropractic medical training, doing so much additional research out there in the field as well. What has been your best medicine?
I think ironically, the best medicine for me has been probably twofold. One, fixing an overt problem in the gut. That was a e-break that until that was rectified, it was going to be very hard for me to feel normal and feel well. The other is really the lifestyle pieces. Sleep. I've tried, you cannot get around cheating sleep. And God knows I've tried and I've tried and I've tried, and you can't skirt that. And exercise. Yeah. The more I'm exercising and pushing myself and being consistent, really, the better I feel. And I think, I don't know what your healthcare routine is, but I'm assuming you've tinkered with a lot of stuff. I have also, and you pick up a few points here and there, but man, sleep and exercise have moved the needle more than anything else.
I hope you enjoyed those highlights from this week's Thrive State podcast. To hear the full episode of the podcast, you can listen at Apple iTunes, Spotify, or wherever podcasts are heard. Now, if you're enjoying the content, please help this podcast grow by leaving us a review at ratethispodcast.com/Thrive State. Also, if you really want to get into the Thrive State, people ask me, where do I start or how do I get deeper? Well, here are a few resources for you. Number one, you can pick up 3 free chapters of my book at thrivestatebook.com. In addition, if you want to go a little bit deeper, get to meet myself and my team and get some online coaching, we have an online course called the Thrive State Accelerator. It's the same material I go through to get my clients into the Thrive State. Go to kienbu.com/accelerator and use the coupon code podcast25 to receive 25% off. And yes, I am a concierge physician at the VU MD Performance and Longevity Clinic. I have a very small concierge practice, but if you or somebody you know may want to be a client, consider applying at kienbu.com/VUUMD. And until next time, remember always, always, always that you are your best medicine.